Flu continues to spread in our community.
It is leading to a number of visitor restrictions earlier than in previous years in hospitals and other care centers where it can easily spread. Medical reporter Liz Bonis joins us now with today's health alert on what's going around and how to avoid getting it.
I know you guys are excited about this. The concern is not a huge number of cases of the flu right now, but in the month we are seeing these cases. Normally peak season for the flu is January to March, but many hospitals and health centers as well as schools say it's hitting early and they want us all to stay home if we're sick.
We were concerned because of the activity that we've seen with mostly ED visits being diagnosed, but also because of this increased admissions to the hospital with flu. We're seeing it early, and numbers, if it continues, it's very concerning.
So already in hospitals such as Bethesda North, where we talk to infection control experts, it is suggested children not yet 14 not visit. Anyone with flu-like symptoms, it's also suggested you stay home. Don't go see loved ones or even go to the maternity ward in the hospital. It is also recommended you still get a flu vaccine if you haven't had one. While it may not prevent all of the strains present this year, it could help you get fewer symptoms, or maybe the symptoms won't be as severe if you get the flu. Other than that,
Best prevention is hand hygiene always, and obviously coughing. If you're ill, if you have signs and symptoms, please stay home and not to spread it.
now I did talk to all area health departments today. They say, again, earlier but not huge numbers yet. Children's Hospital said the same thing. The Northern Kentucky Health Department, the one exception, I got a really late report from them that just said so far they've had 178 cases. Their staff has told them that they were coming in so quickly they couldn't keep up. And they said one pediatrician's office alone had 40 cases just yesterday.
Oh.
Now, here's what you need to know. Kentucky tracks the actual flu. Ohio tracks flu-like activity. So whether people are buying Tamiflu, whether people are buying Kleenex, which makes it hard to measure where it's hitting. You mentioned Mason schools are bad.
Devastated.
What they're all hoping is kids are going to go on Christmas break in anywhere from 3 to 5 days. And they're hoping that if you clear the schools, right, kids would love that, and clean them, that they'll come back and it won't be as bad. The problem is that once this starts hitting, you go to grandma's house, then grandma gets it, and that's a whole, that's our follow-up story to this.
Dominoes.
The schools are like petri dishes right now.
I know. Can I just remind you guys, sneeze in your sleeve, please, okay?
All right, what do you
We're
got
back
coming up?
in our